Proponents of AB 1400 say it would transform one of the costliest for-profit healthcare systems in the world. One, they say, often rejects life-saving medical care, even for those with insurance. It's estimated that over 250,000 people in San Diego and Imperial counties don't have health insurance. Rick Epps, a political science professor at Imperial Valley College, says it would provide coverage for the mostly minority population of uninsured and underinsured people in the state.
So we can at least provide a framework and a structure for that, as opposed to just that, when they stumble into an emergency room somewhere and somebody has to take care of them, somebody's still writing the checks.
Dr. William Seng is the past president of the San Diego Medical Society and a board member of the California Medical Association. He says the system does need to change, but this bill should focus on the 7% of uninsured Californians.
I think the goal is really good, meaning the goal is really to get everybody covered, everybody to have that access to the insurance. And the governor has done quite a bit to close that gap. I think we're so close in getting the right direction. AB 1400 really isn't the way to go.
The cost of care would be paid by a single payer, the government, in the form of taxes. The latest estimates say that taxpayers would shell out over $365 billion per year. That's why the proposed bill would require a separate bill to be passed by voters to fund it. Dr. Seng says, costs aside, decisions would also be taken out of the hands of doctors and have unintended consequences.
If you love what you have now, there really is no assurance that you can keep what you have because the systems will not be there.
Epps says just because the vote was scrapped doesn't mean it won't be proposed again.
It's just too important as the baby boomers are aging and the rising cost of healthcare is leaving many people vulnerable, financially vulnerable, and their health is dependent on that. Then we have to do something.
Kitty Alvarado, KPBS News.